Okay, so moving on to our final presentation. This will be from Kuldip, Dave and Neil, again with their presentation, the ALS Association's research strategy to make ALS a livable disease. So thank you.
Hi, everyone. So I'm here with Dr. Kuldip Dave, the head of our research program, to talk about how we're using a research program to make ALS livable. And to remind you what Lance and I were talking about before, livable means helping people live longer lives, improving quality of life, and preventing loved ones from getting ALS. So, Kuldip.
The ALS Association's research program is one of the largest nonprofit research funding programs in the world. We provide funding for biology and genetics, risk and causes of the disease, all through preclinical drug discovery, biomarkers, phase 1, phase 2, and even some biomarker components of phase 3 trials. We also fund managing ALS research projects. And by that, we mean research into assistive technology, telehealth, telemedicine, natural history surveys. And underneath it all, we fund infrastructure because that is a key to making sure this pipeline remains effective and efficient. And at this point in time, we have 150 active projects across 12 different countries and roughly a $50 million research commitment in those projects. This is what we're doing currently. And what I'm going to talk about today is going to describe where we want to be in the next 3 to 5 years. So there is a lot going on already in the clinical pipeline. And the very first strategic goal is to find new treatments and cure. This hasn't changed, but you could see the pipeline is full of diverse trials. There's about 60 different trials in the world currently that span this pipeline. And the good news is that these 60 targets or pathways span multiple pathways, whether that's oxidative stress, inflammation, or cell signaling. And there are about 6 different modalities or approaches that make up this pipeline, whether they're small molecules or gene therapy, cell therapy. What do we want to do? We want to make sure this pipeline keeps having more shots on goal. And we do this by increasing investment across the ALS ecosystem to stimulate drug discovery. We do this by doubling the association's annual spending. We do this by increasing government spending for ALS. And we do this by increasing our own research program leverage. An independent study showed that $40 million of our Ice Bucket Fund resulted in $120 million of follow-on funding. And we would like to continue that and grow that. We would also like to increase the number of ALS clinical trials. It's great that we have 60 trials, but we would love to increase funding for preclinical drug discovery. We have already launched a new program to fund early stage clinical trials. And we're planning to launch a new program to increase clinical trial capacity as well. And third, we would like to increase trial access, recruitment, and clinical trial success. And we would do this by enabling widespread genetic testing and counseling, by building a clinical trial matchmaker tool, and by leading changes to the regulatory process to speed trials and speed approvals. Neil, back to you.
Thank you. So the other thing we want to talk about is how we're optimizing current treatments and care. And there's a research component to that as well. And so it means we have to expand access to assistive technologies and to understand that technology landscape, not just in where the science is, but what the payment rules are, because that impacts on the technologies that people choose to invest in and how they get delivered to people who need them. We have to develop new technologies. We have to increase private investment for commercialization, as well as dealing with that regulatory picture. On top of that, as I spoke about earlier, we need to reduce the complications and burdens of ALS. And so we are launching a new program to think about the real world evidence of current therapies, how we need to think about ways to fund work on how therapies can work in combination. And we have to think about how to improve and measure and document the successes we're having in care services in reducing complications and reducing burden of disease. We need to find out what's working well throughout the world, and we need to copy it everywhere. We also have to make sure people with ALS receive the highest quality services that they can. And so that means we need to think about better ways to engage people into services, better ways to find them earlier so they can get services earlier and planning earlier. Kuldip.
And the third strategic goal for our research program is to prevent or delay harms associated with ALS. And the first thing to think about here is to treat as early as possible. We know that by the time someone has symptoms and are diagnosed with ALS, they have already lost over 50% of motor neurons. Our goal should be to make sure that these symptoms are recognized right away, and people diagnosed with ALS get access to disease-modifying treatments right away. And the ALS Association has worked with experts to already develop and launch the Think ALS tool that you're seeing here on your left side, with a consensus statement on the benefits of early diagnosis. What this tool provides is a comprehensive list of clinical features of the disease that may lead clinicians to suspect an ALS diagnosis much earlier. And the earlier we diagnose, the earlier we can get people with ALS on treatments, available treatments. We also need to identify risk factors to reduce ALS incidence. And we do this by really identifying the occupational, environmental, genetic risk factors, and how do they all work together. We have already brought together key experts to identify gaps in prevention research and are looking to synergize with other funding agencies that fund prevention research. We are planning to fund a new research program to identify and validate these risk factors, and then finally work with appropriate health agencies and governmental agencies to provide guidance and hopefully enable policy changes to reduce risk. And finally, we need to discover and accelerate new preventative treatments. And here on your right, there's an example of this groundbreaking trial, the ATLAS trial, which evaluates tofersen, which is a antisense against SOD1 in people who have the mutations but don't have the disease yet, what we call pre-symptomatic carriers. And this is just an example of a prevention trial. If we can prevent someone to get symptoms in the first place, we can have a significant effect on modifying the course of the disease. So we support widespread genetic testing and counseling programs to enable access to future therapies, and we support gene identification, validation, and therapeutic development for prevention opportunities based on this genetic data or genetic status. Neil?
Yeah, thank you. And so to remind you of how this all fits together, this is part of a larger picture to make ALS livable. And you didn't hear a lot of words about discovery or innovation. This focus on livable really means that we're focused on speed and scale and getting impact as quickly as we can to help people with ALS as quickly as we can. That's the bottom line. And to do that, it's not just a research solution. This talk has been focused on research, but we do have a whole mission solution to make this work. We do have an advocacy program where, in particular with research, we need to engage the government to help fund research. We have to engage the government to help regulate the research process, to work for the particulars of ALS, and to make sure that they're funding and supporting people with ALS so they can actually get all of these new treatments quickly. And then we need our care services program to help people to take best advantage of the services that are out there, the treatments that are available, to coordinate that very complex care picture, and to help people plan and get their benefits in line, to make the research system work. And also to keep an eye on how things are working in the real world to help shape our research agenda going forward. What kind of assistive technologies do we need? how are treatments working together in combination with other treatments, whether it's for ALS or other conditions that people may have. And so we are trying to think holistically about this. ALS is very complex. It affects individuals in lots and lots of ways, in more than just the disease itself. And to make ALS livable, we do have to think about that whole picture of people. So we'll stop there, and we'll take your questions. Thank you.
Thank you. That was a fascinating presentation. Thanks very much. We do have a couple of questions that have come in, which I'll go to. We've got a few minutes just to answer those. First one was, do you envision using more platform trials to speed up the clinical trial timeline?
Yeah, I could take that one. First of all, not everybody may know what a platform trial is. A platform trial is where you test multiple therapies all at once. So instead of doing one clinical trial and then taking all of the infrastructure down and then doing another clinical trial, you essentially build an infrastructure and then have multiple trials, multiple therapies being tested all at the same time. As you know, ALS Association funded significantly a $3 million grant to the United States platform trial, the Healy trial. It is important to keep thinking about that. That's a great start, and it's already showing amazing success. I think over 800 people have been enrolled in that in the platform trial. But what we're doing is we're thinking above and beyond that. We already launched a early clinical trial program with the idea that the early clinical trial program would essentially get ready programs to then go into the platform trial. We're already thinking about a clinical trial infrastructure funding program, which means that we're thinking about, more trials is good, but if you have more trials, you're going to need more sites. And how do we get more sites activated and ready to go? It helps two ways. One, it helps with enrollment, but two, it helps with providing access to people that may not generally have a clinical trial center around them. So these are the ways that we're thinking about maximizing and leveraging and really getting ready programs for the platform trial.
Excuse me. Thank you. There's a couple of questions around, I suppose, around the topic of funding, really, around use of reserves was one question, but also in terms of how much is spent. I suppose the question is around the funding of this strategy and your thoughts around that and what planning's gone into that.
Yeah, I appreciate that question. It's, for our research plan, even though we're relatively big in the ALS space, all the funding that we have is not sufficient to bring a single drug to market in the United States. That's on the scale of hundreds of millions or billions of over $1 billion. And that's just out of reach for us, out of reach for the entire philanthropic community. And to put that into scale, our funding, our research program is less than a tenth of the entire US federal spending on ALS research. And the ALS research spending by the federal government, the US government, has been increasing rather rapidly since the Ice Bucket Challenge, in part because of philanthropic investment. Our strategy really needs to be about guiding the community and leveraging our funding. And so when Kuldip mentioned earlier, when we invest in ALS research, those scientists get follow-on funding for the next stages of their research from other sources. And that was that 3-to-1 ratio, leverage ratio that Kuldip mentioned. Earlier this month or the month before, we completed an internal analysis of our drug development program for preclinical development. And we saw a 5-to-1 ratio of private sector investment coming into those companies and those drugs to take those drugs to the next level, not coming into the philanthropic space, but our philanthropic work going off into and growing in private capital. And the private capital that's coming into the ALS space, I've been noticing informally, is even greater than the federal investment, at least in the last year. So that's great. It's wonderful there's all this energy. It's wonderful there are all these clinical trials. It's wonderful there are all this basic research and work on gene identification and biomarker identification and so forth. I think our challenge in the philanthropic space as advocates for the ALS community is to really make sure people are focused on time to impact, time to benefit to people with ALS. And that's part of what this whole strategy is about.
Brilliant. Thank you. Thank you. I'm sure there might be some other questions in the chat. If I haven't managed to see them or we haven't got to them, I will make sure that we answer those and get back to you. I would just like to ask one very quick question. We've got about a minute to answer this, sorry, which was I was very interested in the Think ALS tool and to hear about that. So I just wondered how well that had been adopted and how you'd managed to get that tool out there into the hands of people.
It's early days still. We just released it, and Jill Yersak did a presentation on it last night, which as part of this meeting. So you should be able to see more about it.
Brilliant.
Yeah.
Thank you. Yeah, I was probably tucked up in bed then, so I didn't see that one, but I will make sure I catch up. Thank you.